1. Compartment syndrome. This is one of the big emergencies in orthopedics. The patient has severe pain that isn't relieved by meds, plus pallor, paresthesia, maybe even pulselessness. As the nurse, you don't waste time. You notify the provider immediately. You loosen the cast or dressing if you can, and you prepare the patient for a fasciotomy. Think, act fast, or the limb is lost. 2. Fat embolism syndrome. This happens after a long bone fracture. Suddenly the patient is short of breath, confused, and you see petechia. What do? Give oxygen, immobilize that fracture, and call the provider. This is life-threatening, and you don't want to miss it. 3. Cast care, wet plaster. When a cast is wet, never use your fingertips. Always handle with your palms to avoid dents. Keep it uncovered until it dries, and never use a hairdryer. Teach patients that patience is better than permanent damage. 4. Neurovascular checks. The 5 P's: pain, pallor, pulses, paralysis, and paresthesia. That's your checklist. You assess the distal extremity every 1 to 2 hours to catch early signs of compromised circulation. Don't skip this step. It's the difference between saving and losing tissue. 5. Itching under a cast. Patients will try anything to scratch inside. Your job? Stop them from inserting objects. Instead, teach them to use cool air from a blow dryer. That's safe, and it prevents skin breakdown or infection. 6. Cast removal. After removal, the skin looks flaky and weak. Remind patients, wash gently with mild soap, no vigorous scrubbing. The skin needs time to recover. 7. Traction care with either skin or skeletal traction. The weights must hang freely and the ropes aligned. Nursing action, never remove the weights unless there's a prescription. If you interfere, you compromise the traction. 8. Pin site care. External fixator pin sites are an open door to infection. You clean daily with sterile solution, monitor drainage, and teach the patient what to report. Infection prevention is everything here. 9. Hip fracture in the elderly. Classic signs. External rotation and leg shortening. Your action? Immobilize the limb and prepare for surgery. Don't let them hop around on it. 10. Pelvic fracture. The biggest risk here is hemorrhage. You monitor vital signs, abdominal girth, and hemoglobin and hematocrit. Internal bleeding can sneak up on you. 11. Total hip arthroplasty. Teach patients, no hip flexion greater than 90 degrees, no crossing legs, no twisting. You use an abduction pillow and an elevated toilet seat. Dislocation prevention is your priority. 12. Post-op hip replacement positioning. No low chairs, and knees should always stay lower than the hips. Nursing action? Maintain abduction and avoid adduction. Again, keep those hips safe. 13. Knee replacement post-op. These patients often get a continuous passive motion machine, or CPM. You monitor closely for DVT and manage their pain. Both are common after knee surgery. 14. Hip dislocation signs. If the hip replacement dislocates, you'll see severe pain, shortening, and an internally rotated leg. What do? Notify the provider immediately and prevent further movement. 15. Post-arthroscopy complications. Always watch for infection and DVT after arthroscopy. If you see swelling, fever, or calf pain, take it seriously. That's your cue to escalate. 16. Amputation. Stump care. Expose the stump to air. Never put pillows underneath. Encourage the patient to lie prone to prevent contractures. Positioning makes all the difference in healing. 17. Phantom limb pain. Yes, it's real pain, not in their head. You treat it with medications like gabapentin or opioids, and mirror therapy is another option. Always validate and treat the pain. 18. Prosthetic fitting. The stump must be healed and the skin strong before fitting. You inspect daily for breakdown because skin integrity is everything with a prosthetic. 19. Osteomyelitis. This is a bone infection. You'll see fever and swelling. Nursing action? IV antibiotics, sometimes debridement. Take it seriously. Bone infections are stubborn. 20. Osteosarcoma. A bone cancer, especially common in adolescents. Your role, pain management, emotional support, and prepping the patient for chemo or surgery. This isn't just about the body, it's about the whole person. 21. Rheumatoid arthritis, RA. This is an autoimmune disease, and the hallmark is symmetric joint swelling. Nursing actions? Encourage range of motion exercises, plan for rest periods, and give medications like NSAIDs and DMARDs, such as methotrexate. Teaching patients to balance rest with activity is key. 22. Osteoarthritis, OA. Unlike RA, osteoarthritis is degenerative. Pain is worse with use and improves with rest. Nursing action. Apply heat therapy, encourage weight loss, and use NSAIDs as prescribed. Movement is medicine, but moderation is the trick. 23. Gout. Classic presentation. Uric acid buildup with excruciating big toe pain. Nursing actions include teaching a low purine diet, giving allopurinol for prevention, and colchicine for acute flare-ups. And remind patients to cut back on red meat, shellfish, and alcohol. 24. Systemic lupus erythematosus, SLE. This autoimmune condition gives us the classic butterfly rash. Nursing actions. Teach avoidance of sunlight, monitor for renal involvement, and administer steroids or NSAIDs. Pay attention to the kidneys, they're often affected. 25. Ankylosing spondylitis. This is inflammation of the spine. Nursing actions. Encourage regular exercise, posture training, and recommend a firm mattress. Stiff spine? We fight it with movement. 26. Psoriatic arthritis. This arthritis goes hand in hand with psoriasis skin plaques. Nursing actions. Administer DMARDs and use phototherapy for the skin. Always treat both the joints and the skin. 27. Juvenile idiopathic arthritis, autoimmune arthritis in children. Nursing actions. Apply heat therapy, encourage activity, and give NSAIDs. Balance treatment with preserving childhood mobility and fun. 28. Osteoporosis. Fragile bones with a high fracture risk. Nursing actions. Encourage calcium and vitamin D intake, weight-bearing exercise, and bisphosphonate therapy. And don't forget fall prevention education. 29. Bisphosphonates, like alendronate. Teach patients, take with a full glass of water and sit upright for 30 minutes afterward. This prevents esophageal irritation. Don't skip this teaching point. It's tested often. 30. Scleroderma. This condition hardens the skin and organs. Raynaud's is a common symptom. Nursing actions. Monitor closely for renal crisis, especially if blood pressure rises or creatinine climbs. The kidneys can fail suddenly. Stay alert. 31. Muscular dystrophy. Progressive muscle weakness, often in children. Nursing actions, physical therapy, respiratory monitoring, and emotional support. Protect their independence as long as possible. 32. Myasthenia gravis. Muscle weakness that improves with rest and worsens with activity. Nursing actions. Give medications like pyridostigmine on time, every time. And monitor respiratory status, because these patients can fatigue into crisis. 33. Myasthenic crisis. This is severe weakness leading to respiratory failure. Nursing actions provide ventilatory support and administer medications as prescribed. Airway always comes first. 34. Cholinergic crisis. This looks similar but comes from too much acetylcholine. You'll see weakness plus secretions. Nursing actions, stop the meds and give atropine. Quick recognition matters here. 35. Guillain-Barré syndrome. Often post-viral, this presents with ascending paralysis. Nursing action, monitor airway closely and be ready to intubate if needed. This is another airway priority disorder. 36. Fibromyalgia, a chronic pain disorder with widespread tenderness. Nursing actions, supportive therapy, gentle exercise, and antidepressants. Validation is powerful here. Don't dismiss their pain. 37. Rhabdomyolysis, muscle breakdown that spills myoglobin into the kidneys, causing dark urine and possible AKI. Nursing actions, give aggressive IV fluids, monitor CK levels, and keep a close eye on renal labs. 38. Cerebral palsy, a non-progressive motor disorder in children. Nursing actions, encourage mobility aids, get physical therapy involved, and administer spasticity meds like baclofen. Early intervention helps. 39. Spinal cord injury. The big risk? Autonomic dysreflexia, especially with injuries above T6. The patient presents with severe hypertension and bradycardia. Nursing actions, sit the patient upright, remove any noxious stimulus like a blocked catheter, and call the provider. 40. Spina bifida, a neural tube defect present at birth. Nursing action, cover the sac with a moist, sterile dressing and prepare the patient for surgery. Protecting that sac is priority number 1. 41. Crutch walking. Crutches should fit with 2 to 3 finger widths below the axilla. Teach the golden rule, up with the good, down with the bad. That means when going upstairs, lead with the strong leg. When going down, the weaker leg goes first. Safety is everything. 42. Cane use. The cane is always held on the strong side. Sequence is cane first, then the weak leg, then the strong leg. Practice this with patients so it becomes second nature. 43. Walker. Use step into the walker, never ahead of it. Elbows should be flexed 15 to 30 degrees. Teach them to move the walker first, then step. Falls happen when patients lean too far forward. 44. Physical therapy role PT focuses on strengthening and gait training. As the nurse, you reinforce and encourage adherence. Don't let patients skip PT. It's part of their recovery. 45. Occupational therapy role, OT helps patients with activities of daily living. Nursing action, collaborate with them, especially for adaptive equipment. OT is how patients regain independence. 46. Pressure ulcer prevention. Turn every 2 hours, offload bony prominences, and maintain skin hygiene. Use cushions and pressure-relieving surfaces. Preventing a pressure ulcer is always easier than treating one. 47. Range of motion exercises. Do passive ROM for patients who are immobile and active ROM for those able to move. Perform these daily to prevent contractures. It's a simple action with lifelong impact. 48. Bed rest complications. Think DVT, pneumonia, and skin breakdown. Nursing action, encourage ambulation, apply SCDs, and use incentive spirometry. Bed rest can cause more harm than healing if we're not proactive. 49. Fall risk patients. Elderly, weak, or confused patients, especially those on multiple medications, are at high risk. Nursing action, hourly rounding and bed alarms. Prevention saves lives and lawsuits. 50. Pain management in musculoskeletal injuries. Scheduled analgesics are more effective than PRN dosing. Nursing action, assess pain regularly and advocate for proactive pain control. Don't wait until the pain is unbearable. 51. Paget's disease. This is disorganized bone remodeling, which makes bones weak. Nursing actions, administer bisphosphonates, prevent falls, and manage pain. Patients need both medication and safety teaching. 52. Osteogenesis imperfecta, brittle bone disease. Children with this condition have extremely fragile bones. Nursing action, handle gently, avoid blood pressure cuffs, and promote safe mobility. Even routine care requires caution. 53. Kyphosis, that hunched back appearance, often from osteoporosis. Nursing actions, posture training and weight-bearing exercise. Strengthening the back muscles helps prevent worsening. 54. Scoliosis, a lateral curvature of the spine, usually screened in adolescence. Nursing action, monitor with school screenings, provide brace care, or prepare for surgery in severe cases. 55. Lordosis, also known as sway back, common in pregnancy and obesity. Nursing action, encourage core strengthening and posture education. Sometimes just teaching awareness makes a difference. 56. Bone density scan, DEXA. This test screens for osteoporosis. Important teaching point, no calcium supplements 24 hours before the test. That detail can throw off results. 57. Calcium and vitamin D, both are essential for bone health. Nursing action, encourage dairy, leafy greens, and safe sunlight exposure. Supplements may be needed for older adults. 58. Fall prevention in osteoporosis. Patients with osteoporosis can fracture with even a minor fall. Nursing action, teach home safety, remove loose rugs, install grab bars, improve lighting. Small changes prevent big problems. 59. Orthostatic hypotension, common in elderly patients with bone disease. Nursing action, teach them to rise slowly, dangle at the bedside before standing, and avoid sudden position changes. 60. Chronic steroid use. Long-term steroids increase risk of osteoporosis and fractures. Nursing action, monitor bone density, supplement calcium and vitamin D, and encourage weight-bearing exercise. 61. Prosthetic joint infection. After a joint replacement, infection is the big fear. Watch for fever, pain, swelling, or drainage. Nursing action, notify the provider right away. Expect IV antibiotics, and sometimes that prosthetic has to come out. 62. Osteomyelitis, chronic care. These patients often need long-term IV antibiotics. Nursing action, monitor their PICC line closely, teach infection prevention, and stress the importance of finishing the antibiotic course. 63. Surgical wound dehiscence. This is when the incision starts to open. Nursing action, cover the site with a sterile saline dressing and notify the provider immediately. Do not try to push it back together. 64. Evisceration. This is even more serious. Abdominal organs protrude through the incision. Nursing action, cover with moist sterile gauze, keep the patient NPO, and prepare them for emergency surgery. Call for help quickly. 65. DVT prevention after ortho surgery. Orthopedic patients are at high risk because of immobility. Nursing actions, apply SCDs, give anticoagulants, and encourage early ambulation. DVT prevention is never optional. 66. Pulmonary embolism, post-ortho. Sudden shortness of breath and chest pain in a post-op ortho patient? Think PE. Nursing action, call a rapid response, give oxygen, and prepare for anticoagulation. This is a life or death emergency. 67. Pressure ulcer. Staging stage 1 is just redness. Stage 4 means exposed bone. Nursing action, reposition frequently, provide wound care, and support nutrition. Healing won't happen without good protein intake. 68. Chronic osteomyelitis. Teaching long-term antibiotics may stain teeth. Nursing action, stress compliance, and emphasize oral hygiene. The key is prevention of further complications. 69. Pin tract infection signs with external fixation. Look for redness or purulent drainage at the pin site. Nursing action, report it early and maintain strict sterile technique during pin care. 70. Septic arthritis. Hot swollen joint with fever? That's septic arthritis. Nursing action, start IV antibiotics and rest the joint. Don't delay. Joint destruction can be permanent. 71. Clubfoot, Talipes equinovarus. This is a congenital deformity of the foot. Nursing action, serial casting with the Ponseti method is the standard. Surgery may be needed later, but early casting is crucial. 72. Developmental dysplasia of the hip, DDH. You'll notice unequal leg length or a hip click on exam. Nursing action, apply a Pavlik harness, and teach parents it must stay on continuously. Skin care under the harness is important. 73. Legg-Calvé-Perthes disease. This is a vascular necrosis of the femoral head in children. Nursing action, bed rest, sometimes traction, and prepare for possible surgery. Protecting that joint is the priority. 74. Slipped capital femoral epiphysis, seen in limping adolescents with hip or knee pain. Nursing action, make the patient non-weight-bearing and prepare for surgery. Don't let them walk, it worsens the slip. 75. Osteosarcoma in kids, a malignant long bone tumor causing pain and swelling. Nursing action, prepare for chemotherapy and surgery and support the child's body image. This is life-changing care. 76. Ewing sarcoma, another pediatric bone cancer, often in the pelvis or long bones. Nursing action, chemo, radiation, and strong emotional support for the family. 77. Juvenile scoliosis brace care when bracing is needed. The rule is 23 hours a day. Nursing action, teach skin care and have the child wear a cotton t-shirt under the brace. Consistency matters. 78. Nursemaid's elbow. This is a common dislocation in toddlers from pulling on the arm. Nursing action, usually it's reduced in the ER. Educate parents on safe lifting to prevent recurrence. 79. Fracture, healing in children. Kids heal faster than adults. Nursing action, teach proper cast care and monitor circulation closely. Parents need clear instructions to keep healing on track. 80. Growth plate fractures. These can impair bone growth if not treated properly. Nursing action, emphasize the importance of follow-up care with orthopedics. Growth is at stake here. 81. Bed to chair transfers. When moving from bed to chair, always lead with the stronger side first. Nursing action, use a gait belt and don't forget to lock the brakes on the wheelchair or bed. Safety first, every single time. 82. Walker upstairs. This is rare, but if it's needed, the strong leg goes up first. Nursing action, teach proper technique and encourage caregiver support. Never let them improvise on stairs. That's a recipe for falls. 83. Crutches. Sitting down. Back up to the chair, feel the edge with the legs, hold both crutches on one side, and sit slowly. Nursing action, reinforce this technique to prevent those common crutch-related tumbles. 84. Post-stroke rehab. Rehab isn't optional. PT and OT are vital. Nursing action, encourage mobility and help prevent contractures. Stroke recovery is a team effort, and consistency makes the difference. 85. Exercise therapy and arthritis. Low impact is best. Think swimming or walking. Nursing action, discourage high-impact activities like running. Protect those joints while keeping them active. 86. Energy conservation techniques. For patients with chronic musculoskeletal illness, pacing is the key. Nursing action, teach rest periods and activity spacing. Remind them it's okay to slow down. 87. Assistive devices. Grab bars, raised toilet seats, and home modifications make life easier. Nursing action, ensure these devices are in place and teach patients how to use them properly. 88. Pressure relieving devices. Foam cushions, air mattresses, heel protectors. All of these prevent skin breakdown. Nursing action, assess skin regularly to catch problems early. 89. Range of motion in ICU patients. Even sedated patients need ROM. Nursing action, perform passive ROM daily to prevent contractures. Movement is therapy, even when they can't move themselves. 90. Rehab team collaboration. Think PT, OT, and speech therapy. Nursing action. Coordinate referrals early because rehab works best when everyone is on the same page. 91. NSAIDs for arthritis. They're effective for pain, but they can cause GI bleeding. Nursing action. Give with food and monitor stool for blood. Teaching patients about this risk is essential. 92. Opioids for fracture pain. These are usually short-term solutions. Nursing action. Monitor respiratory rate and prevent constipation with stool softeners or hydration. Always balance pain control with safety. 93. Gabapentin. This drug is often used for neuropathic pain, like phantom limb pain. Nursing action. Monitor for dizziness and sedation. Remind patients to take it consistently, not just when the pain spikes. 94. Muscle relaxants, cyclobenzaprine or baclofen. They relieve spasms, but they can sedate. Nursing action. Caution patients about driving and monitor for safety. A relaxed muscle shouldn't come with a dangerous fall. 95. Allopurinol for gout. This prevents uric acid buildup. Nursing action. Teach patients to take it daily, drink plenty of fluids, and watch for rash, which could signal Stevens-Johnson syndrome. This is prevention, not a flare-up med. 96. Colchicine. This is for acute gout flares. Nursing action. Monitor for GI upset and bone marrow suppression. It's effective but comes with risks if overused. 97. Steroid injections for joints. These provide short-term relief. Nursing action. Monitor for infection and educate patients not to rely on repeated injections. Long-term, it's not a solution. 98. Bisphosphonates for osteoporosis. They prevent bone loss. Nursing action. Take with water, remain upright for 30 minutes, and report jaw pain, which may signal osteonecrosis. Simple teaching prevents big complications. 99. Calcitonin. This lowers calcium and is sometimes used for osteoporosis. Nursing action. If using the nasal spray, alternate nostrils to prevent irritation. 100. Vitamin D supplementation. Vitamin D is essential for calcium absorption. Nursing action. Encourage safe sunlight exposure and monitor levels in patients with chronic illness. Without vitamin D, all that calcium is wasted.